Thank you, Jill. I'm John Rustin, President of the North Carolina Family Policy Council. The governor's veto message on Senate Bill 359 is wrong on at least two fronts. He first says, quote, "Laws already protect newborn babies, and this bill is an unnecessary interference between doctors and their patients." The problem with this statement is that the abortionist does not see the unborn child, in this case, the newborn child, as their patient. To the abortionist, that baby is the product of a failed medical procedure. Senate Bill 359 would set a clear policy that any healthcare practitioner who is present when a child is born alive following a failed abortion attempt must provide medical care to that child. It's as simple as that. Secondly, the governor's veto message says, and I quote, "This needless legislation would criminalize doctors and other healthcare providers for a practice that simply does not exist." Well, if the practice simply does not exist, as the governor claims, then how would it criminalize anything? To the contrary, the U.S. Centers for Disease Control have certified the deaths of at least 143 babies who were born alive after failed abortion attempts. I also have a statement that was published in the spring edition of Issues in Law and Medicine from organizations including the American Association of Pro-Life Obstetricians and Gynecologists, the American College of Pediatricians, the Catholic Medical Association, the Christian Medical and Dental Association, the Association of American Physicians and Surgeons, and several others. These groups, representing over 30,000 physicians across our nation, have called on our national leaders to pass this same legislation on the federal level. In this statement, they say that this legislation, quote, "provides a scientifically sound, medically accurate, and respectful approach to ensure that the innocent human being who survives an abortion attempt will be treated with the same human dignity and respect that similarly aged human beings receive in the course of good neonatal medical care." For these reasons, we urge the members of the North Carolina House and the North Carolina Senate to reject the governor's veto of this life-affirming, life-saving bill and to enact Senate Bill 359 into law. Thank you.